Hey Matt, welcome to the show. Here we are again, the Real Estate Mogul MD, talk a little bit about medicine and real estate. So before we jump into this, just give the listeners just a little bit. First of all, welcome.
Thank you for having me. I appreciate it.
Yeah, I kind of blow by that sometimes, but it's so cool because for the listeners who don't know, we talk a little bit before we come on here and just a little bit about like that connection and forget to make that connection with the listeners. So why don't you let the listeners know, Matt, a little bit about your professional career up to this point?
Yeah, certainly. I'm a board certified family medicine physician. I went to medical school in New York Medical College, graduated in 2019. Then I did my family medicine residency at Chestnut Hill Hospital in Philadelphia, Pennsylvania. Finished that up in the summer of 2022. And then right out of that, me and my business partner, who's also a physician, we started our own private practice called Blue Ocean Health. And we've been doing that ever since July 2022. It's typical these days from doctors. Most don't start their own private practice. They join an employed group. Me and my business partner, pretty early on in medical school, we found direct primary care, fell in love with it, really wanted to do it. And we kind of just decided coming out of residency and starting it was actually the best time, which is paradoxical. I think most people think, well, why not get yourself established, make some money, and then dive in. We were both young, single. We didn't really have much responsibility. We were used to living off of, not that much income. And we figured this would actually be the best time to take a stab at starting our own private practice. So that's kind of what we did. We didn't join any groups. We didn't get employed. We just started our private practice directly out of residency. Biggest reason that we started this is primary care is difficult in the sense that you're handling a lot of different things. It's not a specialty where for example, I'm just a knee guy and I just focus on the knee. Primary care, you need to know a little about everything and anything. And when patients come to you, they often have multiple concerns and multiple things that overlap. So to properly address those things, you really need more time with patients to have much more in-depth conversations, to really figure out what's going on and how best to treat them. The issue that me and my business partner have with modern medicine today and modern primary care is it's very much a volume-driven factory model in terms of you got to see 20, 30 patients a day, you get 15 minutes or less with them, and you move on to the next patient. It doesn't really allow for those in-depth conversations. So a lot of times you're asking surface-level questions and you're slapping Band-Aids on a pretty deep, complex health conditions. Where I think the beauty of direct primary care, which is what we do, is we get to spend a lot more time with our patients to really have those in-depth conversations, ask those deep questions, and really figure out what's the best strategy to help patients get healthy and stay healthy. There's actually a beautiful concept in the healthcare commercial real estate world that's beginning to see increasing popularity, and it's office co-sharing, but specifically for medicine. And there's a company up here called 𝗏𝗃𝗀𝗁𝗏, which has that concept and is building that and establishing it. They have a location in Philadelphia, New Jersey, here in 𝗘𝗀𝗏𝗀𝗀, where we're at, and they're expanding into Texas, and goal is to go nationwide. But the beauty of it is it's kind of turnkey in terms of they have everything pre-furnished. So if you look behind me, you see the nice cabinets. It's got a nice sink, the gloves, the sanitary dispensaries. They got the exam tables. So we don't have to build that out. We don't have to worry about regulations, rules, anything like that. We just kind of lease. We pay month to month, and we get a dedicated office space, which for a physician like me in a small private practice is amazing because I don't have to worry about this stuff. Again, I can just focus on medicine, and I'm not locked into a long-term lease. Again, it's month to month. So those things, for me, it was a no-brainer, and I think more private practice independent physicians are looking into things like this. To be honest with you, something along the lines of what 𝗏𝗏𝗀𝗀𝗃 is doing. I just love their model. I think it's a brilliant model. I think it's going to grow in the future because I think you're going to see a return of at least physicians who really want to get back to providing high quality medical care, and they don't have a corporate boss who's demanding them, be on the hamster wheel. So as that grows, I think this market for these, type of co-sharing spaces where you have a very small footprint as a physician you don't want to have to, lay out a huge amount of capital or get a massive loan. You kind of want to be like, all right, this is my small little investment, and it's almost like what we call a micro cash practice. And as it grows, great, and I can expand my footprint as needed. So I think there's a lot of interest from at least the doctor world. So that's where I see a big opportunity, and at least something that me and my partner are discussing in terms of that. Like, I guess you would call that commercial real estate, aspect of it. But, that's what I would say, beyond just the residential, home investing. I think just getting into, number one, investing earlier. I think we all make that mistake. One of the big rules is the compounding effect. We underestimate that. When the younger you start, the better. So that's number one. Number two, so I'm a huge believer in habits. Show me your habits, I'll show you your life. I'll show you your financial life, your health, your family, your social relationships, everything. I think so developing the proper habits, earlier and sustaining them is the most important thing to me. So when it comes to finance and real estate, something that I have started that I wish I had started earlier was reading and researching this stuff. So, when I was 23, 10 years ago, I could have had 10 years of learning about this stuff that I already had under my belt that I don't have currently. So those would be the two, biggest things that, if I could go back, that I would have done.